Thank you for joining me, everyone. As Sophie said, my name is Dr. Ryan Anderton. I'm one of the medical assessors who works in the medical department. I'm a consultant in aviation and space medicine and also a GP by background. So I thought it would be helpful for me to come and talk to the community, the general aviation community, about how to look after yourself, maintain health, and why that's important. The World Health Organization describes looking after your health, and the reason for that as a pilot as being the process of enabling individuals and communities to increase control over the determinants of health and thereby improve their health. And essentially what that's saying is that's giving people the power to look after themselves, to improve their general health, and therefore actually improve outcomes, improve how long they can continue to fly without problems, how long they can continue to fly without medical intervention. Historically, in aviation medicine, the approach to pilot health has been based on detecting increased medical incapacitation risk. So that is once it has occurred. So we'd be looking to pick up medical problems once they've happened. But actually, medicine changes and evolves, and this includes aviation medicine. And new guidance from the International Civil Aviation Organization focuses on prevention. And therefore, that's trying to minimize the amount of disruption to an individual's flying career. So that's a real shift in aviation medicine. And that's a global approach from ICAO that is being encouraged and pushed forward. So why is health promotion in aviation important? Well, I've just touched on some of the main driving reason behind that in terms of trying to keep pilots healthier. So lots of individuals are having longer flying careers. And that's not just professional pilots, that's private pilots as well. So the longer people are flying, that population is also aging. With an increase in age in the pilot population, we do have an increase in health problems. So looking after health throughout a pilot's career or private flying life is really important, actually. And if the earlier we start, the greater success we will have. An increased annual flying hours. So lots of pilots are working longer hours or flying longer hours privately. And that might be related to work or greater affordability and being able to fly more. So increased physical and mental demands. And it's really important that we think about those mental demands and not just our physical health. So I could talk to you about people having heart attacks or diabetes or back problems, and we think of that as a physical health problem. But actually, the psychological impacts of day-to-day life and increased longer flying hours poses a risk to our mental health, and that's something that is super important. And there really is no greater time to be talking about this than following the last 18 months and the COVID-19 pandemic. So mental health in the general aviation community is so important, and it's something that we must pay attention to and think about. And then lastly, on the slide, you'll see increased financial pressures and worries. So with all the sort of stresses and strains of life that people are facing, we need to be aware that that can have an impact on individuals' mental and physical health as well. So all of these things come together to drive us to push health promotion in aviation. Why is a clinical examination of aircrew necessary? So it's a question that does get asked often as pilots and air traffic controllers. Going for a medical is part of life. And really, this is just a reminder that when you have your medical with your AME, it's an opportunity for them to pick up any asymptomatic conditions that might result in you becoming incapacitated. So that is a condition that you might know nothing about, but poses a risk to your health and therefore your flying. Blood pressure is a great example there. People can have really high blood pressure and have no problems or symptoms at all, but it does lead to significant health risks long term and even in the sort of acute, immediate setting. They also, your AME needs to review any pre-existing conditions that might progress. So it could be a muscular problem or a neurological problem or blood pressure. It's an opportunity to see how you're getting on. Have things changed since your last medical? And are the risks to you flying still the same as they were last year? It's an opportunity for your AME to ask you some screening questions. So questions you might not ask yourself about being fit to fly, similar questions that your GP might ask. What's your bowel habit like? Has there been any blood when you've gone to the toilet? What's been happening with your weight, or how has your mood been lately? So those questions are things that might not generally arise if you didn't sit with somebody and talk about those. And those questions some of those can happen over the phone, but it is also good to do those face to face. So cardiovascular, so listening to your heart, there really is no substitute for listening and examining someone. And we pick up things that people didn't know were there. And sometimes that might not make us popular, but other times it might save somebody's life. So these are an opportunity for your doctor, your AME, to pick something up that actually we can intervene with, or your treating doctors can intervene with, and result in a positive outcome. Gastrointestinal, so again, examining you to look for any signs or symptoms of perhaps disease processes. Same with the nervous system, so testing your reflex and nerves, trying to make sure that actually you're still up to fly the aircraft and the demands that places on you. And the same applies also to our endocrine system, being able to examine you and check you for things like your thyroid gland that can lead to difficulties if that's abnormal, and also skin and your lymphatics or immune system. And so an opportunistic chance to look and detect perhaps skin cancer that you hadn't noticed was there. So the clinical examination leads to a wealth of information gathering that is used to positively influence, your outcome, both on a personal level and actually helping to keep you flying rather than trying to look for reasons to stop you flying. So ICAO has pushed the health promotion for pilots, and they actually published a book which is available for all pilots to purchase if you want to have a look at that. Or you might want to ask your AME. I know several AMEs have copies of them in their practice. Pilots and patients will ask me, well, how do I know what I can trust, or who do I trust with what I read on the internet? So this is evidence-based, and importantly, it's realistic as well. So it talks about realistic goals for maintaining and looking after your health, because if something isn't realistic, people won't do it or follow it. So how do we keep our cardiovascular system fit? So our cardiovascular system refers to our heart, that's the pump, and the vascular aspect is all the piping. So that's all our arteries and our veins that pump the blood and around the body and back to the heart again. And it's crucial that we look after that. Our cardiovascular risks increase with age. So it's really important that we keep active, so exercise, understanding your blood fat levels. So your AME will talk to you about testing your cholesterol or your lipids, managing your blood pressure. So maintaining a good and healthy blood pressure throughout your life is really important, as that impacts so many different things. So healthy diet and weight, those seem like the obvious ones, but those are the things that you can definitely look at and work towards improving. Understand the risk of diabetes. Diabetes affects a large number of people, and that's either sort of diet controlled or type 2, which is tablet controlled, and then ultimately insulin diabetes. So understanding how that impacts you and the impact of your diet and your weight on the risk of developing diabetes. In the aviation environment, particularly, you're flying at altitude, the risks of lower oxygen levels and hypoxia are made worse by smoking. So it's something that really is great for people to stop if they're doing it. Now, I touched earlier on mental health, because without a healthy mind, it doesn't really matter how healthy your body is, you're going to run into problems. As a private pilot myself, being mentally astute, being able to focus when I'm in the aircraft and to understand what's happening around me, my situational awareness is so important. So thinking about how we connect with others, our friends, our family, how we talk to people about how we're doing in life. Keeping active, it's not just good for your physical health, it's certainly a huge improver of mental health. That's something I've done throughout my life and continue to do, including learning to fly. By learning, we are using our brain and our neurons, and we're making sure that actually we keep mentally as sharp as we can do. Giving to others, actually, I think that comes from being able to help other people share your experiences in life, and your skills and your knowledge actually does improve our well-being and our sense of self. So it's fantastic to be able to do that. Being mindful, just being aware. Okay, if you don't know what it means to look after your mental health, or what mental health is itself, again, there's a huge variety of resources. The ICAO book is one of those, online, talking to colleagues and your AME as well. And then really, really importantly is knowing where to seek help and when to seek help. So, self-help is fantastic, using apps online, meditation type things, time out, looking after yourself, having a hobby, but actually sometimes self-help isn't enough, and making sure that you approach people, either your AME or a friend or a colleague or a family member, when you feel that you're overwhelmed is so important. And seeking help early means things are much, much likely to get better quicker, so people can keep flying for longer. I think it's important to touch on cancer. The latest guidance is that 1 in 2 people will get cancer at some point in their life, and we'll certainly all know somebody who does. So the risks of cancer are always present, and that's no different in aviators to the general public. There are some risks that might be greater, exposure to sunlight, depending on where we fly. But the usual things I've already sort of talked about can help. So obviously stopping smoking, that's a big risk factor for lung cancer. Eating a healthy diet, maintaining a healthy weight, cutting back on our alcohol intake and sticking to the government guidelines on alcohol intake. And if you're not sure what that is, it certainly has changed in years gone by. So do be looking at the number of units you come to drink. Avoiding sunburn. So it depends on where you're flying or actually just your holidays in between flying, but avoiding sunburn reduces your risk of getting skin cancer. And as people get older, that risk increases in part because they've been around longer and exposed to more light. So checking yourself regularly, getting someone else to check you is important, and your AME should be looking for things like that when you have your medical, and staying active as well. There are certain types of cancer that are increased due to infections, so things like hepatitis or parasitic worms or HPV virus. So talk about this often when I talk to our commercial pilots as they're traveling all around the world, but many of us are lucky enough to travel when not restricted by the pandemic. So thinking about things like that as well. And then talk to health professionals. So what sort of cancer screening should you be undergoing? Your GP should be in touch with you about things, but you can take things on yourself. Have a look on the NHS websites, look at what sort of things you should be screening for, and take charge of your own health. How can you reduce your health risks from musculoskeletal injury? Well, we're at risk of musculoskeletal injuries every day. It's about being aware of where those risks come from and trying to mitigate or reduce the chance of them happening. So sit less, move more. Certainly sitting at an office all day long in a sedentary job puts you at greater risk of developing musculoskeletal injuries. If you are going to improve your physical activity levels, do it slowly. So have a bit of a plan. Don't suddenly enter a marathon, in 2 weeks' time. Build up sensibly. Ask the advice of professionals. So PTs or people at your gym, colleagues online, have a look at things from those sources. Avoid exercise when feeling unwell, and looking at your ergonomics. So your position at how you sit at a desk, how you carry things, so important with musculoskeletal injuries. So if you can take an opportunity to review that, please do so. Musculoskeletal injuries are a huge source of frustration, of time off work, and then ultimately time off things like flying. So getting in and out of small cockpits in a Cessna 152 is incredibly difficult if you have some kind of injury. So obviously you shouldn't be doing that, but trying to make sure that you prevent musculoskeletal injuries mean there's much less of a chance that you will have to stop flying for a period of time. Taking care to avoid accidents or falls, especially if you're tired, and actually smoking's thrown there again because it does increase the risk of some musculoskeletal injuries. Nutrition and weight management. This sounds like an obvious thing to talk about, but actually, we see an increasing number of people with increasing weight, and it's becoming a big problem. So weight has a significant impact on people's long-term health. So we need to be thinking about the number of calories that are required as an individual and really looking at that closely, minimizing the intake of food with high refined sugar contents, making sure that we eat a balanced diet. We might even think about more plant-based options, reducing our salt intake. But essentially, this is the one thing that you really can control, and you can make your best effort to improve your own individual situation. This next slide looks at the importance of getting enough sleep, ways to improve our sleep for better health. Sleep is integral to sound mental health and physical health. We all know what it feels like if we miss a night's sleep and how we can function the next day. So long-term sleep is so important. Again, activities in there. So exercise and keeping active means you're much likely to have a better sleep cycle. Avoid drinking alcohol before bedtime. That really does disrupt our sleep pattern and the quality of our sleep. Smoking, nicotine also impacts our ability to sleep soundly and the sleep cycles. And using sleep opportunities wisely. Different countries have different approaches to sleep. You won't find me saying having a nap is a bad thing. I think actually if your body's telling you you're tired and you need to sleep, taking opportunities to gain that sleep whenever you can is sensible. Obviously, if you're falling asleep regularly at times in the day when you wouldn't normally sleep, that's an indication that perhaps you're not sleeping well at night and there might be a problem. That links in again to things like our weight and our health, something called obstructive sleep apnea. So if you are overweight, drink excessive amounts of alcohol, that actually this can impact your ability to sleep, leads to problems of sleepiness during the daytime, and it's a significant risk to aviation. So you'll find guidance on things like sleep apnea on the CAA website, and that you are at your absolute best when you're flying. Hearing and vision, probably the two most important senses for pilots when we're flying. So it's really important that we look after these. So protect your hearing, and that includes wherever you are. So whether that's listening to music or at work in the cockpit, making sure that you're wearing hearing protection if you need to is really important. Keeping the volume down on devices. Lots of people are working from home and having headsets on for long periods of time during the day. Ear protectors at work. Aviation is obviously crucial, that environment. Not flying when you have a respiratory infection. So the risk of causing problems to the ears or long-term damage is increased if you go flying whilst you have congestion or respiratory infections. So don't fly if you can't perform the Valsalva. So the Valsalva is something that we all sort of know. We're usually asked to do it in our medical, and you can do that by sort of pinching your nose and blowing out to create pressure in the ears. If you're not sure, if you've got pain when you do that, or you're not sure at all whether you should be flying, speak to your AME. If it's related to other hearing problems, unusual ringing sounds or deterioration in your hearing, speak to your GP as well. And then vision, again, reduce your exposure to UV light. So wearing appropriate sunglasses when you're flying, not there just to make us look cool, but actually to make sure that we're protecting our eyes from the UV damage when we fly. So this last slide looks at where to get help. So knowing that you need help is important. That's the first step. You might need some advice about something. So recognizing that need or that gap in your knowledge or an awareness of what might be happening, but actually where to go to get help. So first port of call, ask your AME for aeromedical advice. I know you all do it, and your AMEs are fantastic at providing that sort of advice. If you're not sure, ask your AME. Talk to your GP if you've got symptoms or you're worried about your physical or mental health. So you can talk to your AME, but actually don't forget your health outside of flying is just as important as your health related to flying. So your GP can direct you. Lots of AMEs are GPs, and there's a crossover, but talk to your GP if you're concerned. And then online resources. So I touched on those earlier. There are too many to list here, but I think, NHS Online and their conditions and symptom checker. If in doubt, ask somebody. Much better to be sure before you go off flying. And actually looking after things long term depends on good advice and knowing what to do. Okay, well, that brings me to the end of my talk. I hope you've enjoyed listening to the talk and found what I've said useful. Thanks very much.